Hello everyone, I'm Dr. Tahira, your health coach, and you are watching channel Health Show with Dr. Tahira. Come with me to the journey of health, happiness and awareness. In health today, we will discuss on CS cervix, means cancer of the cervix. Let's talk. Firstly, what is CS cervix? Cervical cancer happens when cells in the cervix, the lower part of the uterus that connects to the vagina, start to become abnormal. Small changes in cell DNA. Cells then to multiply out of control and cells accumulate in growth called tumor. Now talk about its sign and symptoms. In early stages, it is completely free of symptoms, but cervical cancer in advanced age causes vaginal bleeding between periods, menstrual bleeding that is longer or heavier than usual, pain during intercourse, bleeding after intercourse, pelvic pain or pain during sex. A change in vaginal discharge such as more discharge or it may have a strong or unusual color or smell. As the tumor cells die, they may create a foul smelling vaginal discharge which serves as a sign of CS cervix. Discharge may be pale, watery or brown or mixed with blood. Vaginal bleeding after menopause. Symptoms of advanced cancer. Cancer may include loss of appetite, weight loss, pelvic pain, back pain, fatigue, swollen legs, heavy vaginal bleeding, bone fractures. Rarely leakage of urine or feces from the vagina. Bleeding after pelvic examination is a common symptom of CS cervix. Causes: infection with HPV, human papilloma virus. Smoking, chemical in tobaccos can damage cervical cells. Weak immune system. Weak immune system, sexual history, having multiple sexual partners or having sex at young age can increase the risk. Contraceptive pills, taking birth control pills for 5 or more years can increase the risk of cervical cancer. HIV AIDS. The virus that causes AIDS can increase the risk of cervical cancer. Family history. Cervical cancer may have a genetic component. Diet: not eating enough fruits and vegetables may increase the risk of CS cervix. What are the diagnostic procedures to diagnose CS cervix? A doctor may perform a number of procedures to diagnose cervical cancer, including physical examination, Pap test and imaging test. Cone biopsy. Punch biopsy, which use a sharp tool to pinch off small samples of cervical tissues. The HPV test, Pap smear, liquid-based cytology. Colposcopy and biopsy. Cone biopsy. Gold standard diagnostic test for cervical cancer is cervical cytology. Ultrasound can provide highly accurate information about the local extent of cervical tumor. Let's talk about treatment and prevention. Treatment: surgeries, radiation therapy, external and internal radiation therapy, chemotherapy, immunotherapy, clinical trials, follow-up care during and after treatment. When cervical cancer is diagnosed at early stage, the 5-year relatively survival rate is 90%. When cervical cancer is diagnosed after it has spread to near to tissue, organs, or lymph nodes, or regional lymph nodes, the 5-year relative survival rate is 60%. Prevention: regular cervical screening, HPV vaccine, not smoking, not alcohol consumption. High authorities of health launched the global strategy to accelerate the elimination of cervical cancer in the coming decades as a public health problem. Thanks for watching. Share this video with your friends and subscribe my channel Health Show with Dr. Tahira. Thanks. Thank you.